gather around where you can watch,
Are you
okay?
record it with Ryan?
I'm gonna record it, period.
Yeah, so, all right, just relax, okay? So you're gonna go in, you're gonna tell the patient, hi, introduce yourself, and can you tell me your name and date of birth?
Jesse, 1/16/1990.
Okay, so that's good. How you feeling today?
Good.
Okay, one thing that's not on there is pain. So before I get started, I say, are you in any pain?
No.
Okay, but if they are in pain, then you would want to find out 0 to 10. What's the pain? 0, no pain, 10, excruciating. Where's the pain at? Is it sharp? Is it dull? Is it burning? Is it achy? What is it? Okay, so you need to describe the pain. And if she tells me that she's in a pain 8 out of 10, that's pretty excruciating pain. I've looked at her MAR already because I'm a good nurse. Before I ever went in the room, I know that I can get pain medicine for her. So I may put off doing her head-to-toe assessment. I'll say, let me take care of your pain right now. I'll go get your pain medicine, bring the pain medicine to her, give her the pain medicine, chart that I gave the pain medicine, and then I'll go assess another patient and work my way back around to her. And within 30 minutes, the pain should, after I give her pain medicine, the pain should start to ease, and then I'll do it. Okay, don't be so focused. It's like, okay, well, I'll get you some pain medicine after. No, she's not, she may not be breathing deeply enough, shallow and fast because of the pain. Heart or blood pressure, vital signs are not part of the assessment, but all those things are gonna be up. You're gonna listen to her heart, heart's gonna be fast, all that sort of stuff. Let's get her in a more normal state. But she says she's not in any pain. So I'm gonna say, okay, well, I need to just kind of check you out, and I'm gonna work my way from head to toe, okay? All right, so I take my light, go like this, right over her pupil, hold it there, and I should be able to see her pupil constrict. And then I'll just come around, you go from the outside in, do the same thing, and I'll say, okay, can you follow the end of my finger with your eyes without moving your head? And that's good. So vision and all that sort of stuff is intact neurologically. I'm still, and she's oriented to herself, right? I could say, do you know where you're at?
The hospital?
Okay, no, we're at school. So you don't even know where you're at. I'm just playing. And then you can say, do you know what day of the week it is?
Wednesday?
Yeah, so she's alert to person, herself, she knows who she is, she knows where she's at, and she knows what day it is. She's alert and oriented to person, place, and time. If she knew who she was, but she didn't know where she was at or what day it is, then she's alert and oriented to person only, and you would chart that, person only, okay? Okay, I'm gonna be touching you and listening to you, okay? So just let me know if you feel any pain. You wanna feel her neck, make sure it's nice and supple, feel for glands under here, any swelling, okay? You don't feel anything, you just keep moving, okay? That's about as far as I go as far as touching is concerned. The next thing I do is I put my stethoscope on. Once I get my stethoscope on, I keep it on pretty much until I'm done with it. I don't like taking it on and off, okay? So, and you have to listen to front and back. To do a good abdominal assessment, they need to be kind of laying down. It's hard to do a good abdominal assessment if they're sitting up, okay? So I'm just gonna tell her, I'm gonna listen to your heart. There's an acronym, it's called MTAP. M is the mitral valve, which is right where the apex of the heart is. Apical heartbeat. It's also called mitral valve, point of maximal impulse. It's 3 names for the same location on the body. So that's mitral valve, that's M. The tricuspid valve, which is the valve between the right atrium and the right ventricle, is right there. The aortic valve is here, pulmonic valve is here. So M, T, A, P. So I'm gonna listen to her heart. I'm just gonna tell her, I'm gonna listen to your heart, and I'll just go ahead like I want you guys to do, and I'll listen. Okay, so I heard that, just listen for a few beats. You don't have to listen for long. Okay, now we're going to listen to breath sounds. I'm here, our heart sounds good, okay? Can you take a deep breath in for me? You listen for any wheezing, any kind, you should just hear nice clear breath sounds going in and out. Another deep breath. Okay? So that's listening to the upper lobes in the front. We're going to listen to the middle lobes. My hands are cold.
Yeah, they are.
Take a deep breath. Another deep breath. Okay, so our breath sounds are clear. I'm not done with lungs yet. I'm going to listen to the back, but while I'm here, I'm going to go ahead and listen to her abdomen. So just rest for me. just below her rib cage. And you listen until you hear a gurgle. You can listen for up to 5 minutes, okay? Before you say there's no bowel sound.
I can hear myself.
There's a gurgle. There's a gurgle. There's a gurgle, okay? Let me sit you up real quick,
So
okay?
pretty much like one of the 4 quadrants or whatever?
When we listen to her lungs in the back, I'll start up here. When we listen to the upper lobes, again, you can't be over the shoulder blade, you have to be over soft tissue. Nice deep breath. Okay? One more time. Okay? Again, you can't be over the shoulder blade, so you can actually palpate where a shoulder blade is. I take my middle finger, run along where the shoulder blade is. When I get down here, I just put my stethoscope right under that. Deep breath. And you always compare side to side, okay? Good. Okay, can you lay back down for me? We always want to compare side to side to make sure if there's any difference in volume, if one side's louder than the other, because if she had pneumonia on one side or something like that, it would be quieter. Or do we hear crackling or gurgles or, any kind of wet breath sounds, okay? We always want to compare side to side, so you always go from here to here. Then I went from this side to that side. It needs to be even, right? This sound quality. And then when I listened to the back, I did the 4 areas. You don't go top to bottom, top to bottom. You go top to top, bottom to bottom, okay? So now I'm done with my stethoscope, okay? But I'm not done with her abdomen yet. So abdomen, it's always look, listen, and feel. So I'm gonna look. It's flat, okay? So that's a good thing. If it was distended and really tight, like she had a bowel obstruction or something, and it was just backing up with fecal material or something, it would be really distended. If it's round because they're a larger person, you chart what you see. So for her, I would chart that it's flat. You can start in any quadrant you want. I always start, and it's divided up into 4 quadrants. So you got right upper, left lower, right lower, okay? So you just find where the ribs are. I just go right below the ribs, and I say, let me know if this hurts. Just do that a couple times. You move over to the other side. You move down. And while I'm doing this, I'm conversational. When was your last bowel movement?
A day or 2?
You don't remember? Was it yesterday or the day before?
Day before.
Okay, was it normal for you?
Sure, yes.
And going to the bathroom every couple of days, is that fairly normal for you or not?
Yeah, it's normal.
Okay, so that's normal for her. So she had a normal bowel movement 2 days ago, that's normal for her. Now, while I'm here, I also need to do genitourinary, right? So I've got, and also, my hands are kind of, when you get into these quadrants, you got bowel there, but you got ovaries down here too, actually a little lower, or ovaries, I could palpate that. Okay, that's part of the reproductive system, genito, and then right in the middle, right above her pubic bone. When was the last time you urinated?
Well, I gotta pee now, so.
Okay, but when was the last time you urinated?
An hour ago.
Okay, all right, was it normal for you?
Yes.
No burning or anything like that?
No.
Okay, and you're feeling for a distended bladder. If she had trouble like urinary retention, her bladder would be distended. She may feel with me pressing on it that she's gotta go, but it's not distended. Okay, so I'm done with that, okay? So I've just assessed part of her neural system. I've got her heart, cardiac system assessed. I've done her respiratory system, and I've done her GI, and I've done her urinary, genitourinary. We're almost done. So I said neurovascular, so neurovascular. So part of the neurovascular check is just relax, and you want to compare pulses side to side. If you can't do it like that, you can do like this. And when you feel a radial pulse beat on one side, you should feel them beat. They should be equal on both sides. Okay? And hers are. Then I'm going to say, can you squeeze my fingers? Squeeze, 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 squeeze. You're comparing grip strengths, and that's equal on both sides. So everything's normal right now. Okay, could you uncross your legs for me? Okay, so now I'm going to look at her skin. I can ask her if she can have active range of motion or not. Normally I don't if they're laying in bed. You know if the patient's ambulatory, but I'm still doing my neurovascular. Let's take your shoesies off.
My saw it like pure black, just to let
Okay,
you know.
don't worry about it.
Okay.
So we still got neurovascular to do down here, and also, whenever I was doing it here, I paid attention to her nail beds. Just check her capillary refill. Okay, that's normal. They have a pulse here that's called the dorsalis pedis. It's between the big toe and the next toe. You just come up the V and just keep working your way up. I may not be able to feel it because you have socks on. I can feel it on this side. Okay, there it is. So they're equal. So she's got good circulation. Then I would look at her toes, but if she's wearing nail polish, how can I tell? Can I take your sock off?
Yeah.
Okay, how can I tell? Well, I can't do her nail beds, but I can hit the end of her toe and see if the toe blanches, and it does. Okay, and then you would compare both sides the same. Then I would say, can you push against my hands? Okay, can you pull up against my hands? Okay, she's got equal strength. And then I would say, okay, let's just roll on your side facing that way and make sure she's good. And then I'm just gonna say, I'm just gonna look at your skin, okay? Everything looks good. I just did a head-to-toe assessment with neurovascular check. That's gonna be that's your assessment every time you do a head-to-toe assessment on somebody. You include the neurovascular with it, okay? I don't know how long it took me.
11 minutes, 33 seconds.
Okay, 11 minutes and 33 seconds, and I did a lot of teaching along the way. It doesn't take long, it's easy, right? What will help you is being conversational with them. Okay, I'm gonna listen to your heart, and then listen to the heart, and then just move on. I'm gonna listen to your lungs, and just move on to the next system. You can raise her up on her back, have her sit up, or if in the bed, she could be in a semi-Fowler's. You could raise her to a high Fowler's and then have her lean forward a little bit, okay, in the bed. Listen here, let her lay back down. Move on to the GI system, I actually listened to the belly first before I had her move. You always listen to the belly, the GI, the gut first. If you manipulate the gut, what the gut does is it's a self-protective measure. It's gonna stop. It's like, uh-oh, I'm being messed with, I'm gonna stop manipulating the gut. So you're not gonna get, you may or may not hear bowel sounds. Okay, so you always look, she was flat, listen, all 4 quadrants, and then palpate for pain. And then while you're doing this, I'm on the gut, I'm gonna say, ask her about her bowel movements. Then I'm gonna move on to genital urinary, and when I'm palpating her bladder, I'm gonna say, ask her about her urine, okay? And then after I've done there, then I finish my neurovascular checks, strengths, pulses, capillary refill, and then pretty much all you gotta do is just look at her skin throughout, okay? Does that sound easy enough for you guys? We'll probably do it on the mannequins.